During the height of the pandemic, many people missed doctor's appointments and important medical screenings. That's why one of the reasons the state has launched a campaign to encourage adults to get screened for colon cancer. Join us now with more on the Get Screened Hawaii campaign are Dr. Ankur Jain with the Hawaii Comprehensive Cancer Coalition and George Stewart, who's a colon cancer survivor. Good morning, gentlemen. Thanks so much for joining us today.
Good morning.
Morning. Thanks for having us.
Yes. Now, Dr. Jain, I want to begin with you. How common is colon cancer, or maybe uncommon, and what can people do to prevent it?
Sure. So colon cancer remains the third most common cancer in the United States and the second most common cause of cancer-related deaths. Here in Hawaii, it was estimated approximately 700 new cases were diagnosed with more than 200 deaths over the last year. And unfortunately, these numbers may be going up with delay in screening during the COVID pandemic.
Can you talk more about that delay in screening? Because a lot of people didn't get screened because medical offices were closed, and maybe now they're catching up. Do you have the numbers on the missed diagnoses?
So those numbers we're still waiting for from the state. It was estimated, though, the first 2 to 3 months of the pandemic, when there was a required lockdown, there were approximately 90% drop in colon cancer colonoscopies, colon cancer screening, and it's estimated that over the next decade, this may result in approximately 5,000 excess deaths from the disease. Now, these numbers go up every time there's a surge, as patients are fearful or scared to undergo their screening tests, and unfortunately, there are a lot of patients that have also lost their insurances, and that also has led to these delays.
So who should get screened? Which age range? And then how often?
Sure. So that's a great question. Traditionally, the colon cancer screening guidelines for average risk patients were to begin screening at age 50. And that is still the most common incidence is after age 50. However, we have been seeing an increasing number of patients younger than 50 with colon cancer with new diagnosis. So the guidelines have recently changed for all average risk patients to begin screening at age 45. However, that changes with certain other risk factors as well as any symptoms, then those patients may need screening, may need evaluation earlier. As far as how often, all average risk patients, it depends on the type of screening test that they undergo. So there are different options. Those include stool tests, which need to be done every 1 or 3 years, depending on which type of test. There's X-ray tests that are done every 5 years. And then the colonoscopy, which is considered the gold standard, if normal in an average risk patient, can be done 10 years. So all of these have their own pros and cons, risks and benefits. Stool tests are the ones that can be safely done at home for those patients who are still fearful of the colonoscopy. However, it's important to note that colonoscopy can still be done safely during the pandemic with several precautions in place. However, as we tell everyone, the best screening test is the one that gets done.
Now, George, can you share your story with us? When were you first diagnosed?
Let's put it this way. I was diagnosed at the age of 73. This year I turned 79. And it was unexpected to me. I was in excellent health that time and eating properly in there. With the diagnosis, again, the colonoscopy was the one that saved my life, if I could say that. But, you know, it's getting there and doing it. It's not worried about the prep or anything. It's like buying insurance in there, insurance on your life, and what Dr. Jain just said, and how many people die from it in there. I'm one of the lucky ones at this point in there. So it was quite a journey for me. I had 3 operations. I had blood clots in all lungs. I had infection, and I was caught early. And so I am a survivor in there. And my chances are 90%. If you get caught later in life, you may be looking at percentages of 40 to 50%. And that is terrifying, that you're going to leave your loved ones behind or possibly be endangered with after effects of being treated in there. So it's been a good treat for me. I've been blessed. I'm good to be here today. And I cannot underestimate the fact that you need to get to the doctor and get your colonoscope done. Colonoscopies are a life-saving effect. They were for me in there. We buy insurance for our home, our cars, everything else. This is insurance you can buy for yourself personally, you, your family, and your loved ones.
And how are you feeling today?
Fantastic.
You look great.
Well, we not only look great, if I can throw a pitch in here, we're in our 7th year with an organization called Compassion for Cancer Caregivers. So that gives you an idea. We went back into the marketplace and started helping people. that needed help. Thank you for that.
All right, so don't wait. Get your screening. Get back into the offices. The offices are back open, and the doctors are waiting to see you. So, Dr. Jane, thank you so much for joining us, as well as yourself, George Stewart. Very important message this morning.
Thank you.
Thank you so much.